So Tara, today we're sitting down to do the adult pre-exercise screening tool. The purpose of doing this is to identify what we call contraindications to exercise, and that could be any present threat that could be harmful to you while exercising. So that could be something like a swollen toe or anything as bad as heart disease. So we're going to do stage 1 and 2. In identifying any contraindications, it helps to determine the appropriate intensity of exercise that we can develop into the program, and it also helps determine what exercises will be appropriate to incorporate into your routine. But most importantly, it tells us whether or not we need to refer you to a specialist. So are you happy to go ahead and have a crack at this?
Yeah.
So your last name's Dymock, D-Y-M-O-C-K.
Yes.
And date of birth?
The 5th of the 7th, 86.
Okay, cool. So has your doctor ever told you that you have a heart condition, or have you ever suffered a stroke?
No.
Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise?
No.
Do you ever feel faint or have spells of dizziness during physical activity, exercise that causes you to lose balance?
No.
No. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
If you have diabetes type 1 or 2, have you had trouble controlling your blood glucose in the last 3 months?
No.
Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity or exercise?
No.
Do you have any other medical conditions that may make it dangerous for you to participate in physical activity or exercise?
No.
Okay, cool. Because you've answered no, we can move on to the next stage. Could I just get you to sign there? Thank you. Okay, so this is stage 2 of the pre-exercise screening tool. Can I ask your age, Tara? It's 29?
Yeah.
Is there a family history of heart disease, as in like stroke or heart attack in your family?
No.
Do you smoke cigarettes on a daily or weekly basis, or have you quit smoking in the last 6 months?
No.
Can you describe your current physical activity or exercise levels? So, would you say exercise in a sedentary, light, moderate or vigorous fashion?
Light.
Light. And how many days a week?
3.
And how long do those sessions go for?
About an hour.
60 minutes? It's minus 1 risk factor. Can you tell me your height?
170 centimetres.
And weight?
72 kgs.
So we've got that as a BMI of 24, putting you in healthy range according to the calculator. Have you ever been told that you have high blood pressure?
No.
Have you been told that you have high cholesterol?
No.
Have you been told that you have high blood sugar?
No.
Have you spent time in hospital, including for day admissions for any medical conditions, illness, injury during the last 12 months?
No.
Are you currently taking a prescribed medication for any medical conditions?
No.
Are you pregnant or have you given birth within the last 12 months?
No.
Do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity?
No.
No? Okay. So what I'll do now is what we call the risk stratification. I've marked you as -1, so I can ascertain that you are at a low risk level, meaning that we can go ahead with an exercise plan and we can probably start exercising today. So low risk clients are individuals at low risk may participate in aerobic physical activity or exercise up to a vigorous or high intensity. So according to our exercise intensity guidelines, vigorous or high means that you can go 90% heart rate max or greater, and you can go above your rate of perceived exertion above 7. So that's pretty good news. The best thing about this result is that we won't have to refer you to a specialist, so we can actually get started today.